Most dog owners know about keeping their dogs safe in the car, and Teddy's family are no exception. But sometimes dogs can be just like toddlers, very excitable.
He came in a couple of weeks ago after he'd fallen out of the car. So the owners have a four-wheel drive car, and it was stationary at the time, and they opened the door up, and Teddy, being as excitable as he is, he fell out from the front seat. Now, he landed awkwardly, landed on his back and hit his head, and when he landed, he had like a small seizure, and so then they rushed him into the local veterinarian, who referred him in here. That he had marked swelling of his head. So if you look at little Teddy's head now, it actually looks pretty good, but when he came in, he looked like a cone head. You know, there was a large swelling on top of his head. Now, we were worried when we saw that, and he was a little bit dull mentally, and so we actually performed a CT scan to get a better look at his head. So if you look at the CT image, on the right-hand side, you can see that there's a whiter area, sort of like a circular whiter area. That's an area of bleeding into the brain that's occurred as a result of the trauma when he fell out of the car. So we would call that a hematoma. And then if you look at the top, where there's the break in the skull that we talked about, the open fontanelle, you can see that there's this soft tissue that's herniating out through the top of the skull, and that's his brain that's being pushed out the top of the skull because of the increased pressure, because of the bleeding that he sustained in his brain. Now, the thing about Chihuahuas, it's a little bit different to other dogs, is that they often have what are called open fontanelles. So these are little sort of suture lines in the skull as it's forming as they're a baby, and in most breeds they close as the puppy grows. Now, in Chihuahuas and other sort of brachycephalic breeds, sometimes they're left open, and so there's like a hole a defect in the skull. Now, in his case, he was kind of lucky that he had that, because it acted like a pop-off valve. So the swelling in the brain actually had somewhere to go. So the CT scan showed that he had a hematoma, which is like a blood clot on the left side of his brain. And then the swelling was able to come out through the top of the brain and relieve some of the pressure, the intracranial pressure. So we just treated him with anti-inflammatories and rest, and we were very, very careful around his head, obviously, and he's done really well.
Now, if a young child has a fall, they usually let you know by crying, but what if your dog had a fall and you didn't see it? How would you know if anything was wrong?
Yeah, I guess the main thing would be that they seem dull, their personality has changed, they're very withdrawn, they may actually have it doesn't have to be a full-blown seizure, they might have a partial seizure where they just have episodes where they might twitch, they might go a little bit stiff, so mainly changes in mentation.
Well, let's hope next time Teddy takes a moment or two to think about things before he jumps out of the car.